Hello there. Welcome to my show, COVID-19 update by Heerak. Yeah, we're just like a couple days away from New Year's Eve. Can you believe that? Year 2020 is going away and year 2021 is coming. So many of you are probably very excited to be celebrating New Year's Eve in a couple days. Today is National Heroes Day. For those of you whose husband booked you, planned a family vacation in the Caribbean for New Year's Eve, your husband's probably your hero. You know what I mean? Just make sure you wear an N95 mask on your flight over to the Caribbean. You know, there are a lot of countries where there aren't that many COVID-19 deaths. Seychelles Islands, which is one of the popular vacation spots, especially for the French, has zero deaths so far. It's like a paradise island. Um, yeah, so who's your hero? you know, Uh, you know, yeah. I mean, obviously all the dads want to be a hero. And if you have the money, why not, kind of splurge, for New Year's Eve or New Year, like this time of the year. Um, if you could rent a private jet, if you have that kind of money, it's probably safest, right? you know, to rent a private jet over to Caribbean where there aren't that many cases and rent a house or bungalow or, one of those isolated places and you have food delivered to the door. You're probably fairly safe, for the week, as long as you have your private beach. Um, yeah, so I mean, there are ways to celebrate New Year's safely in COVID-19. Probably there's no place as dangerous as America to be on New Year's Eve. Um, we have the most number of cases and deaths, so that's why. But yeah, all the moms and dads want to be hero of their children, right? Um, Obviously, you have to be very careful. You don't want to have a situation where people get COVID, but the most dangerous thing to do is have classroom instruction. Put your child in a classroom for 8 hours with other children in a confined space in a classroom. That's probably more dangerous than any kind of New Year celebration you can do, you know? And that's why, I'm here at Christian Kim, candidate for U.S. Congress in Virginia's 8th District. So vote for me on November 8th, 2022, 2 years from now. You know, election for U.S. Congress is every 2 years. So, so I'm running for 2022 U.S. Congress. So vote for me on November 8th, 2022. And as you know, I'm a big leader in terms of shutting the schools down in order to save your life and your children's life, because I don't want your children to die from COVID-19. Uh, at one point in May, one child was dying per day in New York from what I'm calling New York virus. Um, COVID-19 mutated to infect and kill children through inflammation in New York. And at one point in New York in May, one child was dying per day. So I'm predicting that thousands of children will die from COVID-19 um, or its associated complications by June 2021. So that's why I'm trying to shut all the schools down to prevent thousands of children dying in every state. Children are most safe at home, really. I mean, to be honest with you, there's no one who can take care of your children better than you, like your mom and dad. Um, and that's why I think it's the smartest thing to make sure children stay at home. Um, and then, we have the technology to have remote learning. Let's use it. There's no reason to risk your children's life for education, because especially because we have remote learning devices like internet. So let's use that, so hopefully you'll be heroes to your children by shutting schools down in your areas and take care of them at home, for God's sake. You're their mom and dad. You're the one who's supposed to be making sure they don't die, right, from COVID-19. So hopefully you'll be their heroes. Um, when you ask a girl out for a prom or a ball, you become their hero in a sense, right? The girl who says yes to you, if you ask them out for a prom or a ball, and I asked Rachel Saunders of Northern Ireland out for Jesus Mayball, and you see the center picture there where she and I are there together. You kind of become a hero to the girl who says yes to you. Kind of a hero. you know, I also took Rachel Saunders to a garden party hosted by the president of the university. At Cambridge University's official title is vice chancellor, but equivalent to America's president of university, like at Georgetown University, that'll be President De Hoya. Uh, you see the photo right below the video there, where I took her to the garden party, and I have like some royalty friends. See there in the center is Prince of Freiburg in Germany. Next to that is Elioshe, Prince of Macedonia. So yeah, it's nice to hobnob with royalty and nobility of Europe. They're really nice people. There's no law or no rule that says wealthy and powerful people are mean people. There are a lot of nice people among royalty, nobility, and powerful people. Yeah. Unfortunately, we have 24 hours of COVID-19 death that is equaling 3,088 deaths. So 3,088 people have died in the last 24 hours. Um, so we have our death rate is still 2%, but 337,918 people have died from COVID in the United States alone. That's like the size of a city, you know. City of Edinburgh in Scotland is only about 500,000 people. So, that's a lot of people who've died from COVID so far. Um, Confirmed cases are at 19,526,228. Um, so, we have, I mean, it's getting up there, but we still have less than 10%. Uh, in fact, less than 7% of Americans have been infected with COVID-19. So, it's not that bad right now. I mean, obviously, it's going to get worse. So that's something that you can expect. But as of now, it's still okay in terms of not that many Americans being infected. And that's part of the reasons why a lot of Americans are celebrating Christmas and New Year's because, in relative terms, not many Americans have been infected so far. And obviously, we're never going to achieve herd immunity. You need like over 70% of people infected, and that's not happening. So, COVID-19 is here to stay. And another reason why we're not going to have herd immunity is because COVID-19 is mutating. So people who got infected before can get infected again, which means we can never achieve herd immunity, right? Because the virus has changed. So COVID-19 is aggressive, but it's not fast enough, aggressive enough to achieve herd immunity. So, so it's here to stay next 365 days a year. COVID-19 is going to be killing like thousands every day. Uh, until next Christmas, you would have to wear a mask, you have to social distance, thousands of people will be dying per day. So that's something that's a new normal in America, unfortunately. It's not going to go away because the only way to kill virus is quarantining, and none of the states are quarantining right now. So quarantine means like you shut everything down, not like, you know, it's not like stay at home. Quarantine is like everything shuts down. Unless you have that COVID-19 is not going to go away. So just expect to have COVID-19 every day of next year. Probably year after that as well. Probably continue for decades. kind of HIV virus has been around for decades and kills, hundreds of thousands per year. And hepatitis C kills, um, hundreds of thousands every year as well. So, COVID-19 is probably like that, except the problem with COVID is it's a respiratory virus, although it does damage in many different parts of the body. Because it transmits through respiratory uh, communication, it's easy to get. Like HIV, unless you have sex with somebody who has HIV, you're not going to get it. Or near share a needle with somebody who has HIV, you're not going to get it. So yes, it's a dangerous virus which kills people, hundreds of thousands every year, but it's hard to get HIV. But COVID is different. You just have to speak with people who have COVID, you could get it. So that's a very dangerous thing, unfortunately. Um, Europe is getting up there in terms of COVID-19 death. Russia is number one with 3,073,928 cases, 2% death rate, 55,107 people have died. So that's a lot of death for Russia. China's death is under 10,000, and it has 1 billion, 1.2 billion people. Russia's population is far smaller than that. So Russia is becoming like rest of Europe in a sense in terms of COVID-19 deaths. France has 2,631,110 cases and 64,204 people have died. So it's 2% death rate so far. United Kingdom is number 3. In terms of cases, it's smaller than France, but death is higher because their death rate is higher. So 2,389,940 people have gotten COVID, but the deaths are at 71,675. Yeah, which is unfortunate because England death rate is rising. Obviously, all of these countries death rate will rise over 10% by June because flu season, you have exponential growth of COVID-19 deaths. That's a lot of people are going to die, and that's one of the reasons why some people want to have a last dang party, New Year's party before going. We know that United Kingdom had a lot of raves with thousands of people, which were secret. So you can expect that in United Kingdom, you're going to have a lot of secret New Year's party with thousands of people partying, like in every part of UK. So their death rate may rise to like over 5-6% right after New Year's Eve, because all over England, Scotland, Wales, Northern Ireland, you're going to have thousands of people partying, young people partying in rave parties, New Year's parties, because that existed like in May. So since they did it in May, they're going to probably do it again now. Um, so you're looking at massive COVID trans, uh, you know, um, transfer. Young people get it; they could die from it, obviously, but they could also give it to like others who are not so young. Yeah, I expect a lot of COVID cases and deaths soon after New Year's in England. Um, that's the country in Europe with the most massive secret rave parties. But I'm sure it exists in France and Russia as well. That may explain why Russia has such a high death rate. It's probably young people are partying it up secretly, underground or whatever. Turkey is number 4. Um, and it's 2,178,580 cases. And in terms of death, there are 20,388 deaths. So 0.9% death rate. So it's under 1%. But 20,000 is no joke. I mean, as I said, China had less than 10,000 deaths from the very beginning of the pandemic till now. And China has like 0 death per day right now. So, I mean, Turkey is obviously minuscule compared to China. So, I mean, it's doing better than other European countries, but it's not doing that well, There are a lot of countries with 0 death per day, including New Zealand, which is a Anglo type of people race. They have the same race as like English, but they have like what, 25 deaths or whatever, since beginning of pandemic. So it's not the race thing, right? In a sense, although obviously, New England has more white people who are not racially mixed. So I mean, it could be that people in Africa doesn't have that many deaths either because they're black and they're not racially mixed. So maybe people with interracial marriage may have more vulnerabilities than people without interracial marriage. Because China, everybody's 100% ethnic Chinese, and so there's no racial mixture for like 5,000 years. Um, so that may be the reason why the death rate is lower. Like Japan is racially 100% Japanese, and their death rate is low. So maybe being pure blood, whether you're white, Chinese, or black, strengthens your DNA against your body against the COVID. I don't know. I mean, people have to do this research, but I don't see Center for Disease Control doing this kind of research. They need to do the research because it's relevant information, right? Because it relates to your survival. But New Zealand, white people are racially homogenous. There is a lot of racial mixing, and that may explain why their death rate is really low. Um, Someone needs to do the study to see whether that's a factor or not. Italy is number 5, and it has 2,067,487 cases. 4% death rate is has the highest death rate in Europe, and 73,029 people have died, highest number of deaths as well. So Italy is doing something wrong. They need to do something right. They need to reflect on themselves to see what they're doing wrong and then go back to doing what they should do, which is the right thing to do. Yeah, so today's title is UK COVID mutant strikes US. So the mutant COVID that was discovered in UK was discovered in United States today. Yeah, I mean, you can bet that it's been around US for a long time. Probably came over on a plane from UK. But because we're not sequencing COVID like we should be, it was only discovered today. Like, US government needs to sequence the COVID that people have to see what the different variants are, but they're not doing it. And that's a problem because we have resources to do that. We should do that. Because there is a high possibility that your vaccine, COVID-19 vaccine, will not work with some variants. Maybe American government is afraid that if they research the variants and study it, they will have to tell the truth to American people that COVID-19 vaccine doesn't work against a lot of the variants. So maybe that's why they're not sequencing them, because they want to like kind of project the half truth or lie that COVID-19 can protect you. You know what I'm saying? You know how governments are. It doesn't matter whether the government's controlled by liberals or conservatives, they lie to you, um, for convenience sake or whatever. I mean, that's like not just American government, but every government, that's why they have like confidential files, right? Confidential files have truth, but they keep that from the citizens. That's why they're confidential, where they swear you to National Security Act. So that may be the reason why CDC, Center for Disease Control, or US military is not sequencing the COVID viruses like they should be, because if they sequence it and then they research it, they have to tell you the truth. And the research will be out there for scientists to look at, that COVID-19 vaccines don't work against a lot of or most of the variants, right? So because they're rolling out the vaccines, they don't want to know the truth. You know how people have bad news and you don't want to know it. You know how that is. So it's kind of like that right now. There's such a focus in the Democratic Party, especially on the vaccine and its effectiveness. It's like they're really superstitious, Democratic Party. They think the vaccine will save you. So they want to kind of project this lie or this half truth that the vaccine will block out all COVID virus, which is not true, because there are variants that could get through, even if it works. Um, so obviously, if they don't sequence the DNA or sequence the COVID, then they could just perpetuate the lie that COVID-19 is 95% effective, right? Right? They haven't really done any research on at the genetic cellular level of COVID and the vaccine. But I think the truth is more important. I know the government has its agenda to spread COVID vaccines, but we need the truth, and that's why I'm calling on U.S. government and its agencies to sequence all COVID, especially among patients who die. I think it should be standard practice that if somebody dies from COVID, that that person's COVID should be sequenced. To see which variant killed them, and they need to keep a record of which variant killed which people. I think it's not too late to start that. They should have started from the very beginning, but they need to do that because we need to see which variant is killing the most number of people in America, right? We need to know that because COVID-19 is forever. It's going to kill thousands of Americans in year 2000, millions probably in the year 2021. We need to know which variants are the most dangerous. Obviously, scientists need that data so they could kind of try to fight that, the most destructive and the variant that kills the most people, right? Um, let's read the first article. Colorado, first state in U.S. to confirm new, more contagious strain of COVID-19. If there's one case discovered, there are thousands out there. You know what I'm saying? Where there's one, there's like thousands. And that's like, most scientists understand that to be true. And where there are thousands, there are potential for millions to get infected in the next few weeks. Colorado, first state in U.S. to confirm new, more contagious strain of COVID-19. Jessica Seaman in Denver Post, today's article. Colorado public health officials on Tuesday confirmed the presence of the new variant of COVID-19, first discovered in the United Kingdom, saying the state is the first to identify the strain in the United States. The health and safety of Coloradoans is our top priority, and we will closely monitor this case as well as all COVID-19 indicators very closely. Police said in a statement, it's the name of a person, we are working to prevent, spread, and contain the virus at all levels. Well, you need to quarantine, right? The new strain could be 117, has spread throughout the UK since September, but it's unclear whether it originated there. The new variant has pushed the UK into tighter restrictions. So I guess Colorado will be going under tighter restrictions. Obviously, they need to. The new strain is very aggressive, and there's scientists are not sure whether vaccine, if it works, will work against the new strain. Because variants can evade vaccines, right? Yeah. Second article, dying young, the healthcare workers in their 20s killed by COVID-19. A lot of nurses are in their 20s. They graduate from nursing school with a bachelor's degree, bachelor's of science in nursing. They're like 22 or 21, 22. So they start nursing at hospitals at 21, 22. In my RN residency program at Virginia Hospital Center, there are a lot of nurses who are in their 20s who just started with me at Virginia Hospital Center. We have like 16 people in our residency program. A lot of them are 20, like in their 20s. So Obviously, this information is relevant for RN residency nurses, not just the Virginia Hospital Center where I work as a registered nurse, but like Innova Fairfax Hospital, Innova Alexandria Hospital, MedStar Georgetown Hospital, MedStar Washington Hospital Center, Suburban Hospital, Sibley Hospital, Children's National Hospital, George Washington University Hospital, Adventist Hospital in Shady Grove, St. Mary's Hospital. Like all these area hospitals have new nurses who are in their 20s, many of them. So this information is very, very, very relevant because it shows that they can die from COVID. So let's read the article by Alistair Gee in Kaiser Health News. This was in August 13th. So obviously they were dying then, they'll die now. And they'll die in the future as well. While COVID-19 takes a far deadlier toll on elderly people than on young adults, an investigation of frontline healthcare workers, worker death by The Guardian and KHN, Kaiser Health News, has uncovered numerous instances where staff members under age 30 were exposed on the job, like being a nurse, working in the nurses unit, and also succumbed, meaning died. Yeah, so I want to do a chair because, as you know, I graduated from master's in clinical nurse leader program at Georgetown University School of Nursing and Health Studies on August 24, 2020, with 24 other people. So 25 of us graduated on August 24, 2020. Many of the graduates are in their 20s. They graduated from their college, came straight over to master's program at Georgetown, like Claire Paoletta from Falls Church. She's a local Yoko. She went to Georgetown Prep School for high school and then went to to a Jesuit school in New York. And then after graduating from bachelor's, came to Georgetown. So she's in her 20s, early 20s, probably like 23. She's 23, and then Ying Fu McMillan. Hi, Ying Fu. Hi, Claire. Ying Fu, she graduated from University of San Diego on and got married. Like few weeks after graduation, she got married to a really nice guy. I mean, he's a great guy. So both of them lucked out because both of them are wonderful. I'm glad that they found each other. And they drove across from San Diego to here, Washington, D.C. And so Ying Fu is probably like 23 as well, like Claire. You know, there are others who are like that. You know, they just graduated from college, came over, so they're like 23, 24. We actually had one girl in our program who is like 22 now. She graduated from her college at 20. She celebrated 21st birthday in the first year, and then she celebrated 22nd birthday in the second year. She graduated, so she's 22. She's African American from Maryland. She commuted from home. She lived at home and commuted every day when we had classes. She's really smart. She's a really smart girl. Obviously, you know, she graduated at 20, and I think she's the youngest in our program. She graduated at 22. Like right after her, she turned 22. So yeah, so you know, we have a lot of 22-year-olds, you know, 20-year-olds, 22, 23, 24-year-olds in our program who graduated. As you know, COVID-19 is killing a lot of people, you know, of all ages. And I'm predicting at least 5% or, you know, or 20%, which is 20% of us will die by COVID by year 2021. So that's going to be at least 5 of us die. That's if all 25 of us are working in hospital. Some of them are not working because they're afraid to die. But yeah, but so I want to do a cheer for my fellow nursing students from Georgetown. CNL 2020, yay! We graduate from Georgetown. We may die from COVID in 2021, but at least we could write in our tombstone, Hoya 20 CNL. Yeah, so Yeah, I mean, you gotta celebrate the achievements, right? Whether you die or not, you know. I mean, COVID-19 is killing people. I mean, we don't live in a fantasy world, right? We live in reality. COVID-19 is killing people, killing nurses in their 20s. It's going to kill people. It will kill some of us in our CNL program. I mean, that's like given. I mean, you can't live in a fictional world, right? You got to live in the real world, right? You cannot like run away from the truth. COVID-19 is going to kill nurses, a lot of nurses, you know, including nurses from Georgetown. Bachelor's of Science in Nursing students as well. Um, so yeah, so yeah, so let's read that article. In our database of 167 confirmed frontline worker deaths, so Kaiser is keeping their own database, but there are a lot of databases, so they don't have everyone. They just keep a certain number of people, maybe in their own hospitals or whatever. 167 confirmed frontline worker deaths, 21 medical staffers, um, or 13% of the total were under uh, 40, and 5% fatalities were under 30. So, you have a lot of people dying. 5% are dying. So if there are 100, 5 are like in their 20s dying. Yeah, 13 of the 100 are like under 40. So yeah, I mean, there are people dying in their 20s. This was in August, obviously, but that's going to, we're going to have people in 20s dying in December and in January. So the median age of a COVID-19 death in the general population is 78, uh, while the median age of the healthcare worker database in the database is 57. That's in August. So obviously, older nurses who are like 60 years old are dying more. Doctors who are like 60, they're dying more. If they get COVID, they have high chance of dying. If you're like a nurse or doctor over 60, or respiratory therapist over 60, or physical therapist or occupational therapist over 60, you have high chance of dying. So you get COVID, you die. So they're keeping the death rate pretty high, at 57. But there are nurses dying who are 20 years old, 20s, 30s. So that's, you have every age group dying. Um, and that's going to be the case in the winter as well. This is in part because we are including only people treating patients during the pandemic. So they're only examining healthcare workers like nurses who are actually treating COVID patients. And that's where they're getting the record. And obviously it's a small sample. They're not doing study of everybody. They're kind of, they have their own database that's drawn from maybe it's at hospitals. There are Kaiser hospitals here in this area. Um, I think there's a Kaiser hospital in Tyson's Corner, but and I think they're building a new one. Oh yeah, near Innova Fairfax Hospital, they're building a big Kaiser hospital, I think. So yeah. Um, Third article, Minnesota's new COVID-19 death include 2 victims in 20s, and this was in December 10th. Staff in U.S. News. Um, 2 Minnesotans in their 20s were among the 89 new deaths from COVID-19 reported by state health officials Thursday. So in one day, 89 people died, and 2 of them were in their 20s. An unusual development in a pandemic that mostly claims the lives of elderly patients. This was in December 10th. It was a while ago, but Minnesota's Department of Health shows that the young victims included someone 25 to 29 years old in Ramsey County and someone between 20 and 24 years old in Rice County. Minnesota has only 8 fatalities in their 20s out of a total of 4,198 of all ages. One of our, we had 2 people from Minnesota in our program, Lauren Elwell. Lauren Elwell, she actually did a missions for ELCA, Evangelical Lutheran Church in America, for 1 year in Madagascar. So she graduated from her Christian college, and then did 1 year of uh, kind of missionary work with Evangelical Lutheran Church of America in Madagascar, and then came over for this program, Master's in Clinical Nurse Leader at Georgetown University. Hi, Lauren. She's great. She's a wonderful person. I like her boyfriend as well. She picked a good boyfriend. He's a nice guy. He does research at NIH, National Institute for Health. He's a researcher, and yeah. So she's from Minnesota. So she's probably like 20. When she entered the program, she was probably like 21 or 22 or around there. She's in her 20s. She's in the group like 20 to 24. And then, we also had another person from Minnesota, Neela Whitico. She did her bachelor's program in social work, and she worked as a social worker for a while, especially with mental health, substance abuse, and I believe also like suicide, cases as well. I think so, but she worked as a social worker, and then she came to Georgetown for her master's in clinical nurse leader, and she's great. She makes really good cookies and shared it with us, cakes and cookies. Hi, Neela. Hi, Lauren. Neela's great. She gave us like free foods, like that she made, cookies and cakes. It's so good. I bet everybody's going to miss Neela the most because of her cookies and cakes. And we'll never forget those nice cookies and cakes she always brought us. Yeah. So her boyfriend is really lucky. He's from Minnesota as well. And apparently his her boyfriend's father and mother are big Trump supporters. Yeah, I guess a lot of people are. You have like you know millions of people voted for Trump around the country. So obviously you're going to find people whose parents or who voted for Trump. So that's like everywhere in America. But anyway, yeah, her boyfriend's really nice. He's like a football player, and I guess he worked for emergency medicine, like emergency like medicine at yeah, uh, you know uh, uh, at a hospital in Washington D.C. And Neela's working in the ICU as a hospital nurse and ICU nurse, and she's great. That's what she wanted. I'm so glad she got what she wanted. And we're fellow Sigma members. Sigma Theta Tau. Um, so she made the honor society, and I made the honor society. So both of us are in the honor society, and she's really smart. Neela's pretty and smart, and Laura's smart too. Laura's pretty and smart too. They're both really nice. Their boyfriends are really lucky. That they should propose to them and get married. I mean, gee, yeah, but yeah. So yeah, so yeah, we have like great people in our program. There were 3 guys: Billy Sneed, who went to U.S. Naval Academy and served 20 years in the U.S. Navy as an officer, and Grant Allen. Yeah, he just graduated from North Carolina State, so he's probably like 24 now. He graduated, came over to Georgetown, did his 2-year program. His sister, older sister, also did master's in clinical nurse leader at Georgetown. I think his sister kind of told him about it, and that's how he came. So we have a lot of sibling combination. Like for example, my mentor, every year like older class mentors the younger class. So my mentor, who was in the clinical nurse leader CNL 2019 cohort, was Jessica Nguyen. She's Vietnamese. She's 100% Vietnamese. She came over to America when she was a teenager with her family. And she's a great mentor. I really love her. And she's working now at Innova Fairfax Hospital in the cardiac unit, and so that's where she got her first job right out of nursing school at Georgetown. Hi, Jessica. And her sister went to University of Virginia for bachelor's, and she started a clinical nurse leader program last year. Not last year, this year. So she came in. She came in the fall of 2000. I think she came in the fall of 2020. It might have been fall of 2019. I'm not exactly sure. I think it's fall of 2020. Yeah, I think that's when she came in. So like Jessica encouraged her younger sister to come to the program. So we have a lot of brother sister combinations at Georgetown. Um, so Grant is like a younger brother of alumna of the Masters in CNL program. So hey Billy, hey Grant. I'm sure they're all watching this show. Everybody watches this show, you know. So yeah, but yeah. So obviously, men or women in their 20s can die. In their 30s can die, and every age group can die. So it's a dangerous thing, COVID-19. But obviously, the most number of people who die are like in their 60s. Nurses in their 60s, doctors in their 60s. They're the most vulnerable, unfortunately. Older you are, more vulnerable you are, obviously. So we're going to have a lot of nurses die from now until June 2021. We have 3 months of flu season. Flu season. I mean, no, we have like 6 months of flu season, but winter, 3 months of winter. Winter started on December 21 or 22. So it just started. So we have 3 months of winter where a lot of nurses will die. Uh, and nurses in their 20s as well. So it's kind of sad. Um, but I mean, obviously, when we went into nursing, like every one of us 25, we started with 34, and then 10 people kind of dropped out of our cohort, CNL 2020 cohort, and then Billy Sneed joined us, so we ended up with 25 who graduated. Um, every one of us did not expect like you know a global pandemic, right? Nursing was probably the safest job in the world before COVID-19, or one of the safest jobs in the world before COVID-19. But now with COVID-19, nursing has become the most dangerous job. So when my fellow CNL members signed up for nursing for this program, probably none of them expected to face death every day that they go to work. But yes, that's how it is now. And so, you know, I wonder what they think, about that, because they probably never thought that they could die from their work. And now they're in the most dangerous job, which is nursing. Um, it's like being a U.S. Marine, right? Or in a time of war. I mean, right now, time of peace, U.S. Marine are fairly, it's like probably the safest job right now to be a U.S. Marine because there's no war. But nursing is a very dangerous job right now, very, very dangerous job. So I wonder what my fellow CNL members are thinking right now as they start their new jobs, because we start our job in the first year of, of a global pandemic, right? So we are the pandemic cohort. CNL 2020 is the pandemic cohort. So I wonder what they're thinking. Yeah. Um, yeah, it's kind of interesting. But obviously, some of us are going to die. That's like guaranteed, in a global pandemic. It's like if you go with a U.S. Marine Corps to battle Brittany, you're going to have some of your fellow Marines die in your unit. It's something that you expect. So I just wanted to cheer again for them. CNO, CNO 2020, CNO, yay! We graduated from Georgetown. Some of us may die from COVID in year 2020 or year 2021, but at least we can say we graduated from Georgetown as a Hoya, yay! Yay! Yeah, so, yeah, one of the reasons why a lot of people are going to be celebrating New Year this year is kind of like they want to stare down at the face of death, or because they're afraid that they're going to die, they want to have a celebration, So you're going to have a lot of people celebrating uh, on New Year's Eve because they're afraid, or because they want to show COVID that they're king. COVID isn't king. Um, but obviously the safest thing to do is stay at home by yourself, watch reruns of your favorite shows or movie. That's probably the safest thing to do. Don't invite people over to your house to watch your favorite reruns with you. Obviously, if you're single, I'm single. I have never been married. I don't have children. At some point you will have to find somebody to marry. So you have to take that risk. Um, but some risks are worth taking. But it's life is like that, and that's another reason why a lot of people, single people, will be celebrating New Year's, because they don't want to die alone. They don't want to die alone in COVID-19, right? Being single was fun before COVID-19, but like everything is closed, and being single, many people are saying sucks, right? So a lot of single people are trying to find somebody to marry and start a family with, because they know COVID-19 is forever. Um, So they're going to go to New Year's party just to meet new people, among whom they may find their wife or their husband. So that's another reason why a lot of young people will be going to New Year's parties, underground or whatever. Uh, yeah, so it's going to be an interesting next few days, because obviously there's a New Year's party, but there's like pre-New Year's parties as well. People like to celebrate, for a few days. So yeah, it's going to be interesting to see what happens. But obviously, if you're single, priority is finding somebody to spend the rest of your life with, to love and to hold forever, right? So that's your priority, probably not other things. And so people have priorities based on, the hopes and dreams that they have. And a lot of people don't want to be lonely during the time of COVID-19, especially women. I think men fare lonely, like being alone, better than women. I don't know. I could be totally wrong, so don't quote me on that. But I think women struggle with loneliness more than men. Um, I don't know. I could be completely wrong. That's just my guess. Um, from what I've heard from women and stuff like that. But yeah, so so some of the guys will venture out on New Year's Eve because they know there are a lot of women who really want a guy. So they feel like they have better chance on New Year's Eve 2020 than they did in year 2019 when there was no COVID. So more and more guys will venture out to these singles venues because they want to find somebody too, obviously. Um, and so it's going to be an interesting next few days. Obviously, the safest thing to do is stay at home by yourself. I understand, like, there's a human need for belonging. If you're already married, you could just stay with your family and it's safe. But what do you do if you're single, right? And you're at the age of marriage? Do you just stay a spinster the rest of your life? You see what I'm saying? So I can see why you may risk COVID-19 infection um, to find somebody, you know, because you're not getting younger, and COVID-19 is not going away. So you feel like maybe I'll find the love of my life and we'll get married and then we'll start a family, and that can happen to a lot of people. So I don't think you're totally wrong to think that that can happen. Sounds like both men and women in 2020 New Year's Eve will be. Some of them want one night stand, but I think given the fact that COVID-19 is here and it's hard to date, I think a lot of people, and a lot of people don't want to be lonely, right? You could have one night stand and then you're lonely because she's gone or he's gone. So I think a lot of people are actually looking for meaningful relationships right now for New Year's Eve, one that leads to marriage. I think that's the difference in this New Year's Eve compared to other New Year's Eves. I think, given the situation that we have, I think more young people, 18 to like 26, are serious about finding somebody to share the rest of their life with. They're thinking more about that. One, because they're probably alone more often than not, and there really isn't entertainment to distract them in most places. So they're thinking more about the future and being more serious about their life. So I think, we may have people coupling over New Year's Eve that ends up in marriage within months or even weeks or even days. Some people may meet and may decide to get married right away, which is not a bad thing. If you have love at first sight, get married. A lot of couples who have love at first sight, they remain married for decades. Some of the happiest marriages are like that. Um, so, but we do live in a COVID-19 America. Yes, 2020 is going, but we can count on 2021 being COVID-19 2021, with COVID-19 killing hundreds to thousands every day in America from day one, January 1st, all the way to December 31st, 2021. So it's a 365 days a year virus. So it's not going to go away, unfortunately. So, I guess it makes you reflect, right, about your life and what's more important to you. What's the meaning of life? What should you value the most? So many people are kind of becoming more reflective and thinking about their life and about the world around them and about future. So in a sense, COVID-19 is bad, but because it's making people think about their life in a serious way, it has some positive impact. Um, yeah, so hopefully, you'll find the love of yourself life if you're single, start a family, and hope that you will find your happiness. As you know, I created this show, COVID-19 Update by Heerak, on April 2nd, 2020, to help you survive COVID-19, help your children survive COVID-19. But I also care about your pursuit of happiness and your liberty. And so I try to provide a program that safeguards your life, liberty, and pursuit of happiness in the show, as you have seen. So yes, you're very blessed that this show is here to help you in this horrible time where, I'm predicting 100% of the vaccines will fail because there are so many variants that have not been sequenced yet, unfortunately. Um, yeah, so you keep wearing your mask, keep social distancing. Um, unless risking that is important for you, I understand, but you're taking a risk. So help you understand that you're taking a risk when you know, when you kind of go out of the warning zone. Um, yeah, but I understand you're willing to take that risk, but informed consent, right? I'm telling you what risks there are and what you should do if you prioritize living. But some of you may say living is not worth living if I don't have love. I mean, a lot of you are romantics. I understand that, and you want to find the love of your life. You don't want to die alone. I understand that. That's I'm a historian. I understand the impulses human beings have, and that a lot of human beings are willing to risk death, even COVID-19 death, to find the love, to find a wife, to find a husband, to form a family with children. And you're willing to willing to take the risk of COVID-19 death. I understand that, but make sure you understand the risk and you make the decision fully being aware of what the risks are. And that's why we call informed consent in nursing. You understand what the risks are and then you take the risk. Um, yeah. But I'll bring you more information tomorrow to help you survive COVID-19, help you make informed consent, informed decisions in the age of COVID-19. So tune in tomorrow. Tell everybody to tune in so that they become aware of what's going on in America and in the world around us, and so they can make informed decisions as well and survive COVID. Um, I hope that you'll be well and that your family will be well too. See you tomorrow. Bye.